Well, thanks, and thanks for having me tonight. I'm going to share a little bit of an overview about the Red Choice program and talk through some of the rationale for the steps of that program and show a little bit of the data behind why we think some of those opportunities are important. So let's just launch right into it. I'll start here. Red Angus females are highly valued by the market today, and I think it's worth taking a step back and asking ourselves why they're so highly valued today. And I think a lot of it has to do with the progressiveness of the breed yesterday. One of those examples is the use of artificial insemination. The use of artificial insemination has really been a part of the Red Angus breed since its inception and formal founding. And just to show you one example of that, artificial insemination now stands on the brink of much greater application in the beef cattle industry. The Red Angus Association allows unrestricted use of artificial insemination. AI and performance testing used in conjunction to compound their benefits will accelerate the breed progress towards its goal of quality, efficiency, and increased production. And that's in 1960, right? So really a long history of progressive use of reproductive technologies within the Red Angus breed, and not only reproductive technologies, but also genetic technologies. Your breed embraced the development of expected breeding values and expected progeny differences and total herd reporting and then more recently genomic testing. And really I think you have a strong place in the industry in terms of your claim to fame for the use of these technologies. Additionally, because of things like total herd reporting, you can focus on some economically relevant traits that have to do with maternal productivity and EPDs for reproductive traits, for example. So the genetics of the Red Angus breed are certainly valued in the marketplace. And a lot of the rationale for the Red Choice program is, where do you go from here? How do you continue to capture value with Red Angus females, not just in terms of their genetics, but in terms of potentially the management value that you can upgrade those genetics with? So the mission is to embrace these proven reproductive and genetic management practices that can lead to high quality and long lasting females that are ready to hit the ground running in commercial herds. And the goals of the program are to promote improved heifer development practices, obviously, increase marketing opportunities for Red Angus females, and create reliable sources of high quality and what I like to call high information replacement heifers for commercial cattle producers. But it's not just a marketing program. In fact, in a lot of ways, that would be the wrong way to think of it, because you sort of don't get to have a high valued marketable product until you do all the components that lead up to that, right? And so really it's not a marketing program. And I think that's why we don't have a Red Choice tag or anything like that specific to this program, at least not in this phase, because yes, being eligible for sale as a Red Choice female is intended to provide buyers some confidence that those females have been managed according to these highest quality standards. But the primary goal is that these better managed heifers retain in their herd of origin, or at least a large proportion of them would, or their extra value can really be measured over time. So it's not just a marketing program. Really, the goal is to have a recipe to screen and develop and breed and select replacement females that can really become really profitable. So here's the timeline for the program. And this is, I realize it seems like a lot on one page, but it's actually fairly simple. There's a little bit of a requirement for weaning, and we'll walk through that, what that looks like. And then a pre-breeding examination, and this might be new to many of you, so we'll spend quite a little time today talking about that. And then in terms of breeding, that's mostly some data that gets collected and turned back in. And then a pregnancy examination, and we'll go through those requirements and what needs to be done at that time as well. That's the skeleton of the program. So let's jump right in. So at weaning, the main requirements are that there's a vaccination for IBR, BVD, PI3, BRSV, and a 7-way clostridial vaccine. In addition, there's a requirement for a brucellosis vaccination. So calf vaccination for brucellosis doesn't necessarily need to be done at weaning age. You could do it, up to yearling age is the requirement. But just bear in mind that does need to be done. You may be in a part of the country where there's really not a high brucellosis risk. Certainly that's the case in Missouri. We don't have a high brucellosis risk. But in our heifer development program in the state of Missouri, we require that just to enable heifers to really easily sell broadly geographically around the country. And so that's the rationale here as well. In addition, obviously, it's a good time to evaluate structural soundness and screen out some heifers that maybe have some blemishes and also do some parasite control as needed. And really, the program in a lot of ways starts with a pre-breeding examination, as long as you've done those other vaccination steps at weaning. So the pre-breeding examination is conducted 30 to 60 days prior to the start of the breeding season. And at that time, there's obviously a booster vaccination and a leptovibrio vaccination, and then a pre-breeding examination by a veterinarian. So that examination by a veterinarian involves a reproductive tract score and a pelvic measurement. We'll go through each of those today and just what that process looks like and what data gets collected and what the goals are. In addition, you'll evaluate structural soundness and blemishes. You'll see that on a lot of these slides, just because that's a good thing to always have your eye on in this program. Again, parasite control is needed, and you'll also want to confirm the eligibility of your planned service sires. So AI sire EPDs and accuracies must meet the requirements, and you can find out a little bit more about that on res.org. And the natural service sires have to have genomic enhanced EPDs and meet the Cabinese EPD requirement as well. So let's talk about the reproductive tract score process. This is a picture we actually took, I think, probably 2 years ago at Red Hill, which has been working with us on a USDA-funded project. And so I thought it was a good example picture to use. This opportunity to do a reproductive tract score is really an assessment of puberty status of each individual heifer. So what does that mean? So from a commercial perspective, heifers really need to reach puberty, not just during their first breeding season, but really prior to the start of their first breeding season. And the reason for that is perhaps more in question than it once was. There's some classic data shown on the left, what we often call the Byerly data, about the fertility of heifers bred on their first versus their third estrus that they ever had. So either their puberal estrus or a later estrus. And at that time, because of this data set, the dogma became that the subsequent estrus was more fertile than the initial estrus that a heifer experienced. Now, modern larger data sets have called that conclusion a little bit into question, but even in the modern data sets, there's still a pretty good indication that heifers that are reaching puberty prior to the start of their first breeding season have some improved reproductive performance in that second year. And so I still think the rationale to push for this is important. And really, before we get into tract scoring, let's talk briefly just about the fundamental physiology at play. I often, when I teach a reproductive management course or explain this process to students, I often talk about a gas pedal and a brake pedal. And so the way that this normally works is we have this positive feedback loop between estrogen and gonadotropin releasing hormone and LH. And so what should happen, and what happens in cycling females, is that estrogen increases and GnRH pulsatility increases and LH pulsatility increases, and that positive feedback loop drives ovulation. But before an animal reaches puberty, and also similarly after a cow has calved, there's a hard foot on the brake, if you will. That brake pedal is pretty pressed down, and that normal feedback loop actually kind of works the opposite way. Estrogen has a negative feedback effect. And so we got to get that brake taken off in order for puberty attainment to happen. That's influenced by a lot of things. It's influenced by how old she is. It's influenced by how fat she is and what her percentage of her mature size is. There's a lot of factors that influence that and whether that brake is likely to be on or not. But ultimately, we got to get that brake turned off. And so the main point I want to make is that this becomes actually fairly easy to characterize in an individual heifer in terms of where she's at in this process by palpating the structures present on the ovaries and also assessing the level of development of the uterus. So in a prepubertal heifer where this brake is really on, because of the low frequency of LH secretion, we just don't have large physiologically mature follicles present on the ovaries. We have very small follicles, small ovaries, small uterine development. And as an animal gets closer to attaining puberty, we can actually palpate some of that follicular activity. And that'll also be manifest as an increase in the size of the ovaries overall and also the size of the uterus. And when an animal has reached puberty, there are also some physical structures we can define. We can find a large physiologically mature follicle and a coiled tract. We can also find corpus luteum present on one ovary that indicates that she's ovulated. And we use a scoring system, a reproductive tract score, and this is a system that was developed at Colorado State in the 90s to characterize or classify heifers into each of these 5 categories. And so I want to convince you that this is an important thing to do, an important piece of data to collect if you want to make not only management progress, but actually potentially even genetic progress. We have a USDA-funded grant. Dr. Decker's lab and I collaboratively have a project going on to collect a lot of this data with the hope of maybe building a more informed heifer pregnancy EPD at some point. But so this reproductive tract score is a tool that individually, specific to an individual heifer, allows us to assess her pubertal status directly, rather than relying on something, indirectly associated with puberty attainment, but not all that precisely predictive, like weight. So the tract is palpated transrectally and assigned a tract score of 1 to 5. So a tract score 1 is a prepubertal heifer. She has an infantile reproductive tract. A tract score 2 heifer is peripubertal, and we would define her as being greater than 30 days away from puberty attainment. And a tract score 3 heifer is also peripubertal, but we would classify her as being within 30 days of puberty attainment based on the size of her uterus, the size of her ovaries, and the physical structures present on those ovaries. Then a tract score 4 heifer, I've already mentioned, has a coiled and toned reproductive tract, a large physiologically mature follicle on one ovary. And that's a cycling animal. She just happens to be in the follicular phase of her cycle. And then a tract score 5 heifer is also cycling, but she's in the luteal phase. So that tract will feel a little bit different. It's distended out instead of coiled and toned. But on one or both ovaries, we can find a corpus luteum or a CO. So that is the tract score system in a nutshell. If you want a more precise description, you can find some of this information in a selection and screening of replacement heifers extension publication that I put out through the University of Missouri. But we do have some size ranges for each of these. This is essentially what your veterinarian is feeling for as he or she does a reproductive tract score. In terms of application, though, the main thing is to understand that this is fairly repeatable and accurate, and it's also useful not just for determining puberty status, but to some degree predicting a little bit things like pregnancy rates to fixed time artificial insemination, certainly timing of conception within the breeding season, which has a lot of commercial relevance, weaning weight of calves, really for the same reason, which is that those heifers that conceive earlier go on to wean older and heavier calves at weaning. Now, I'll show you a little bit of data from the Show Me Select replacement heifer program. Obviously, the Show Me Select replacement heifer program is a lot of the same rationale as the Red Choice program that we're talking about today. In that database, we've been collecting this type of data on heifers really since the 90s. And so there's 42,000 plus heifers in this data set, and you can see the fixed time AI pregnancy rates of heifers as a result of what their reproductive tract score was at the time of a pre-breeding exam. So let's walk through this. If you look at the tract score 1 heifers, those heifers that had an infantile reproductive tract, only 4% of those heifers actually became pregnant to fixed time AI. You'll also notice there's not all that many heifers in this data set. And that's not because we don't find a lot of reproductive tract score 1 heifers, but it's because a lot of times those heifers will get culled out and never exposed for breeding, just because producers have come to understand that that's the type of result that you get. Now, tract score 2 heifer will also have poor reproductive performance in terms of pregnancy rates to fixed time AI. Tract score 3 heifers will do very good, actually, in terms of pregnancy rates to fixed time AI, considering the fact that they're not actually cycling at the time that pre-breeding exam is done. Most of these protocols that heifers are put on in this program involve a progestin, and so keep that in mind. If you, for example, were to do a reproductive tract score and then expose heifers for natural service with no synchronization, you might not anticipate quite that level of performance in tract score 3 heifers. But for the most part, we will see tract score 3 heifers have pretty acceptable reproductive performance. And then, of course, tract score 4 and 5 heifers have the best pregnancy rates to fixed time AI, because those were the heifers that were cycling at the start of their breeding season. So in terms of, I might go back to that here quickly. So in terms of management decisions, the most common management decision would be to cull only tract score 1 heifers, although some producers do elect to cull some tract score 2 heifers as well. Those might be the more marginal type of heifers to invest in, for example. So depending on the level of stringency that folks want to have, or maybe the market that they might have for later conceiving heifers or something like that, potentially would also cull some 2s. That's just an individual decision. And then tract score 3, 4, and 5 heifers, of course, have very good performance. So let's also talk about the pelvic screening component. A veterinarian is going to take a pelvic measurement. For the most part, they're going to do that with one of these, which is a Rice pelvimeter. And this is inserted into the rectum of the animal along with the examiner's hand. And they're going to open that pelvimeter up and take a measurement of height. I'm going to play this one more time. They're going to take that height measurement from the pubic symphysis down here up to the sacral vertebra at the top. And that is the height measurement that veterinarian is going to record. And then they're going to take a measurement perpendicular to that at the widest point. We call these the ilial shafts. So you're going to get a height measurement and you're going to get a width measurement. And the question, of course, is what do you actually do with that information? So here's an example. So let's say, for example, that a height measurement was 13.5 centimeters and the width measurement was 11.5 centimeters. The convention is to multiply those two together. So 13.5 by 11.5. And that would lead to 155.25 square centimeters in this case. Now that's the area of a rectangle. And I realize that the pelvic opening is not rectangular, but this is the convention in the literature in terms of how that area is calculated. So in the literature, if we study that a little bit, small pelvic area at calving is problematic, but it's important to understand the way in which it's problematic. It's problematic related to the birth weight of the calf. So I really like this figure on the right, and this is some work that Bob Bellows did at Miles City, Montana, the USDA research station there. And you can see here in the vertical axis, if you will, incidence of dystocia. And so 0% down here, 100% at the top. And then if you look here towards you, birth weight, with the heaviest on the left at 95 pounds, the lightest on the right at 55 pounds. And then this is their pelvic area at calving at 2 years of age. So larger pelvic area up here towards the front, smaller pelvic area towards the bottom. So it's a little bit hard to interpret, but here's how to look at it. So let's say, for example, we have 95-pound calves and really small pelvises, basically 100% incidence of dystocia, okay? If we have 55-pound calves and Extremely large size pelvises, basically no incidence of dystocia, right? But here's what's important. We can have really large pelvic area, and with really large calves, we will still have incidence of dystocia, incidence of calving difficulty. And likewise, we can have really, really light calves and really, really small pelvises and still have incidence of dystocia. So to manage this problem, we really need to manage both pieces of that puzzle. We need to manage for some reasonable screening of heifers to eliminate some heifers that are going to have some of these really problematic pelvises. And we need to select some service sires that are likely to produce calves that have birth weights in an acceptable range. Of course, nowadays we don't think as much about birth weight. We think about calving ease direct, and that's the best way to manage that. But the pelvic area management, think of this as a screening tool to identify heifers that have unacceptably small or also abnormally shaped pelvic openings. And you will see some of those heifers that have abnormally shaped pelvic areas. I sometimes describe them as being a keyhole-like shape, where it's just incredibly narrow towards the bottom portion of the pelvis. That's one type of abnormal shape to a pelvis that you can occasionally run into. So make sire selection decisions based on calving ease direct for service sires used on heifers. And if you're familiar with a maternal calving ease EPD, that is the calving ease of the daughters produced by that sire. So that's what that indicates. But for producing replacements, for example, you may want to take into account maternal calving ease. But in terms of the service sires used to service heifers, we really need to watch calving ease direct. So it is a much more common today to not try to measure pelvises and then rank animals and just pick the largest pelvises. At one time, historically, that was the approach with pelvic measurement. And basically, you just select for larger and larger frame sizes because there's a correlation there. So don't do that. Don't just rank heifers and try to keep all of your largest pelvises with the idea that you're going to eliminate calving difficulty in your herd. You really won't do that. But it is a good screening tool to have a minimum requirement and then cull heifers that don't meet that minimum. So what should that minimum be? It will vary a little bit, and there are some genetics that put on a lot of growth during pregnancy. I realize that. The red choice requirements are greater than or equal to 150 square centimeters at a pre-breeding exam performed 30 to 60 days prior to breeding. And then again, because some genetics will put on a lot of growth after that point, and because heifers that have reached puberty and maybe have had higher input development programs are going to have larger pelvic areas at pre-breeding, it's really important to, in many ways, give heifers another chance if they fail. At least if they're failing by a reasonable amount, and it's not something extremely small or an abnormal shape. So if heifers are less than 150 square centimeters, let's say are lower input type developed females, or we have females that haven't quite started cycling at the start of that pre-breeding or at that pre-breeding exam. So a lot of Trek score 3 heifers or 2 heifers, for example, remeasuring those females that fail 90 days after the start of the breeding season approximately. So at the time of a pregnancy diagnosis, it is a completely reasonable thing to do to get an idea about their true merit for pelvic area. And at that time, we would recommend that they be greater than 180 square centimeters, because obviously they're also aging and continuing to develop. So that's the idea. So let's say, for example, let's walk through a scenario where we have a measurement of 12 by 10. That's 120 square centimeters. That heifer fails. And so in that case, that would be a good example of a heifer to either cull if we really are confident that she's way behind the rest of the group, or depending on the other management considerations, or to remeasure at the time of a pregnancy diagnosis and ensure that this small pelvic area was really related to her maturity at the time and not something innate about her being an animal that has an unusually or abnormally small pelvis. So you need to understand your genetics a little bit and what it is that you're working with to understand the best route to go in that case. But in general, I would encourage you to remeasure anything and give those animals a shot, especially if you are keeping them and, exposing them for breeding. Okay, so interpreting pelvic area information, the main thing to remember is that this is not going to control for everything. It's going to eliminate some problematic animals, but the service star still matters. And so you don't have a license if you measure pelvises to, relax your sire selection criteria for pelvic or for cavities or anything like that. You need to still be fairly strict about that. That's our other way of managing this problem of dystocia. And also remember, there's always a bell-shaped curve. And so even though we are going to use sires that whose EPDs fall within what we would consider to be an acceptable and risk-averse range for servicing heifers, there is a bell-shaped curve. And so you will still have the occasional sire that throws the occasional large calf. And so it's not going to control for everything. And certainly measuring pelvises is not going to allow you to relax sire selection criteria for cavities. The other thing to remember is, of course, you can still have abnormal presentations, and you will. And so just be aware of that. This is not going to take care of every single problem in calving out heifers. So let's walk through the program timeline in that document I showed earlier. We've walked through the weaning portion of that, the pre-breeding portion of that. At the breeding timeframe in the program, this part is actually fairly simple. You just need to record the dates of AI, if you are doing any AI, and the dates of bull introduction and bull removal if you're exposing heifers to natural service. And then also the service sire registration numbers, which you're likely doing anyway if you're a registered producer, and then the synchronization program used. So for example, let's say you're using a 14-day cedar on heifers and you're performing fixed time AI. You're going to record that on the form in terms of the data that you submit. In addition, there's a pregnancy examination. I'm going to walk you through the rationale for the timing of that. So that needs to be done within 90 days after the start of breeding. So if you begin exposing heifers for breeding, for example, December 1st, just to make the math easy, that's going to need to happen, basically March 1st, right? So it needs to be done within 90 days of the start of breeding. In addition, you need to have a booster vaccination done for leptospirosis. That is not fully protective all the way through pregnancy, so we need to get that booster vaccination done. And then we also need to have we also need to remeasure any heifers that have failed to meet that pelvic area measurement requirement at pre-breeding. The pregnancy examination can be done with ultrasound, or it can be done with palpation. In the Show Me Select program that we've talked about just briefly, that program sees the vast majority of heifers diagnosed for pregnancy with ultrasound. And so I would really encourage you to do that with ultrasound as well. And I think you'll get paid to do that, so to speak, because of just the premium that folks place on AI-produced pregnancies. In addition, another good time, obviously, to evaluate for structural soundness and for blemishes, and to do some parasite control as needed. I put together this pregnancy diagnosis publication. I'll refer you to that. There's a link at the bottom. But basically, the rationale for the timeline of this program is if we introduce bulls, for example, about 14 or 15 days after AI, we can go in and detect pregnancies around 30 days. And that would be our earliest time frame to do that. And we can also reliably distinguish AI versus natural service pregnancies as we go a little bit further out, up until the point of about day 90. And after day 90, the accuracy of determining that AI versus natural service pregnancy, because of this 15-day age difference or 14-day age difference, the reliability really drops off as we get much past that point. And so that's the rationale for have that pregnancy diagnosis done by 90 days after the start of breeding. And if you want a little more information on that, just refer to that extension publication. I think it walks through some of the considerations. So if you want to enroll in Red Choice and you want to get started in this program and try to follow this data collection and development timeline and some of the steps involved. The number one thing you got to do is just reach out to someone at Red Angus, and Chessie is the person to contact if you do intend to participate. You'll give her some basic contact information, and she'll give you an Excel data collection sheet to go ahead and collect that pre-breeding data. That's kind of the first point to collect data. The other thing to do is discuss all this with your veterinarian and make sure that he or she is on the same page about reproductive tract scores and pelvic measurements and pregnancy diagnosis, again, ideally with ultrasound. And if they're not, and if they maybe haven't done some of that, because depending on where you're at in the country, some of this is not always routinely done, just have them get a hold of us. Have them reach out to me or to Aaron Larimore at the University of Missouri, and we can walk them through a little bit of that rationale for this tract scoring system. And this is something that a veterinarian can pick up fairly quickly. It's not going to take them thousands and thousands of head to get good at necessarily, but we can talk through this and make sure that everybody's on the same page. In terms of your official enrollment, when you send that pre-breeding exam data in, or when you get that form from Chessie will tell you how to get that to Aaron Larimore at the University of Missouri, and she'll handle getting those heifers actually formally enrolled. And then after you submit that, Aaron will make sure that you get those breeding and pregnancy data submission Excel sheets as well. And that form is going to look something like this. And these red fields, or sorry, not red, these yellow fields and yellow columns are what you really need to fill out. So for example, that your first name, last name, farm name, address, etc., your veterinarian's contact information. So if there are some questions, we know who to contact. And then the farm tag, the BANGS tag, or their official CAFID vaccination tags. Often that's going to be a metal clip or potentially an EID, depending on what style of tag was put in. The breed, of course, is going to be Red Angus or Red Angus Cross in this program based on the program requirements. Color, tract score, pelvic height, and pelvic width. There's also a lot of other optional fields, and you can certainly fill those out if you want to collect all of that information. We'll obviously take data. We will never turn data away. That's just the way that we operate. So if you're interested, the full description, I've only gone over some of the highlights today, but the full description of the program and its requirements are available at redangus.org. And then again, if you have some questions about the program or you're interested in participating, email that to or email or call Chessie at Red Angus, and she can definitely get you set up. Complementary to this effort, I think I'd be remiss if I didn't try to explain a little bit more about why we're just excited about this effort in general. And that's this project that we have with USDA right now to actually get into the genomics of puberty attainment and fertility in heifers as a function of their genetic merit, right? So we know there's an underlying genetic component to puberty attainment and to fertility. And so far, our tools to predict that, we see these things as being lowly heritable. And so our tools to predict this are not all that good currently. And we think there's an opportunity by collecting data in a little bit more of a rigorous way, and also looking at the underlying genomic variants associated with this. Maybe we could develop better, more helpful predictions of puberty and fertility in heifers. And so if you want to learn a little bit more about this project that we have going on, I'd refer you to Dr. Jared Decker's blog. And Dr. Decker has a nice summary of this effort. In addition, you may have seen this article in the Red Angus magazine last October talking about this effort and what exactly it is that we're trying to do, and the rationale working with Red Angus and Hereford to try to collect these pieces of information, essentially a pre-breeding exam with a reproductive tract score and a pelvic measurement, and then also date of conception within the breeding season. So not just yes, no, did she become pregnant, but when did she become pregnant? Because that has such an influence on her lifelong productivity commercially. I'd also refer you to this. This is my YouTube channel and Facebook page. We put out a lot of content on both of those platforms. And if you want a little bit more information, for example, about reproductive tract scores, or maybe about the importance of date of conception within the breeding season, or even if you're interested in some synchronization products and maybe haven't used any of those before, or you have some questions about those, you can watch a couple-minute video on each of those topics and really know quite a bit. So I'd refer you there. And it's also a good way to stay connected with some of the things that we're doing at MU. We're doing some exciting things, I think, in terms of just trying to make sure these good reproductive management pieces touch a larger proportion of the commercial beef industry, and that more folks realize really the economic importance of doing some of these things and how it can really improve profitability and productivity of commercial farms and ranches around the country. So this is another tool I'd refer you to if you have some interest. This is a set of extension publications. You can buy a print version if you really want a print version, but each of these chapters are also available as a PDF download. And so if you find this online, it's publication CB28, Whole System Management of Beef Cattle Reproduction. It has a lot in here about selection of replacement heifers, for example, and some of the considerations there, and other components of reproductive management systems for commercial beef producers. So I'd refer you to that. And of course, it does have a red-hatted animal on the front, which is always nice to see. I know for those of you that are passionate about the Red Angus breed. And I'm passionate about this program. I'm passionate about where I think the Red Choice program could really take the Red Angus breed, again, not just from a genetic perspective, where you already have a really strong place in the market, but also just from a management system.